Dear panel and judges, today we will be presenting on gold nanoparticle. Our team consists of Glenys, me, Kasturi, and Pei Ying.
X-rays have long been a cornerstone of medical imaging. They allow doctors to peer inside the human body without surgery. But, traditional X-rays sometimes lack clarity. This can make it difficult to diagnose certain conditions. Traditional contrast agents help improve the visibility of organs and tissues. These agents are like dyes that absorb X-rays. Iodine-based agents are commonly used, however, they have limitations. They sometimes provide insufficient contrast. Enter gold nanoparticles. These tiny particles are revolutionizing the world of medical imaging. They hold immense potential as contrast agents for X-ray imaging. But the real magic of gold nanoparticles lies in their atomic structure. Gold has a much higher atomic number than iodine. This means it absorbs X-rays far more effectively. This results in significantly enhanced contrast in X-ray images.
Now let us delve into working principle of gold nanoparticles as contrast agent. First, injection. Gold nanoparticles are administered into the body via intravenous injection. These nanoparticles are suspended in a biocompatible solution to ensure they can circulate through the bloodstream without causing harm to the patient. Second, targeting process. To achieve precise targeting, gold nanoparticles are functionalized with ligands that bind to receptors overexpressed on the surface of cancer cells. This process allows the nanoparticles to selectively accumulate in diseased tissues, such as tumors, and facilitate targeted imaging. Once gold nanoparticles accumulate in the target tissue, the next step is to capture images. They enhance contrast by interacting with X-rays, light, or sound waves in several imaging techniques. For example, CT imaging, photoacoustic imaging, and surface-enhanced Raman spectroscopy, SERS. After imaging, the body clears gold nanoparticles through natural processes. Small nanoparticles with wavelength less than 5 nanometers are excreted via the kidneys and urine, while larger nanoparticles, 10 to 100 nanometers, are cleared by the liver and excreted in bile.
An experiment was conducted to test on the contrast agent on CT scan. There are 9 mice received gold nanoparticles, 2 received iodine-based contrast agent, and 1 receiving saline. CT was performed immediately at 60 kilovolt peak after 6 hours and 24 hours after injection. The results shown that, in an isolated form in tubes, gold nanoparticles had greater radiographic density than iodine-based contrast agent. In mice, gold nanoparticles provided bright contrast enhancement that enabled clear visualization of the abdominal aorta and renal arteries, which could not be distinguished without a contrast agent. This persisted up to 24 hours, which was the last time point assessed. Contrast enhancement of the vasculature by iodine-based contrast agent was present immediately after injection, but had disappeared by 6 hours. This shows that gold nanoparticles can provide clear and durable contrast enhancement of the vasculature even at 24 hours. Besides, gold nanoparticles are safe with no cytotoxicity on human cells, and in animal studies, there has not been any distress, toxicity, change in hematology and chemistry laboratory values, or pathology on 24 organs and tissues evaluated. As compared, iodinated contrast agent, the traditional method used for CT scan, has its limitations. The short half-life, which requires repeating contrast agent administration, may increase the risk of contrast-induced nephropathy, which occurs in 7% of patients. Contrast-induced nephropathy is associated with a higher risk of mortality because it requires dialysis and cardiovascular events, such as transfusion and vascular complications, thus prolonged hospital course and increased cost. The target audience of this technology will be the healthcare and diagnostic centers for patients with chronic diseases. This provides chronic patients chances to survive by improving the accuracy of CT scan and minimizing the risk of contrast-induced nephropathy. This precision reduces side effects and increases the effectiveness of therapies, which may help in the early detection of cancer cells. Additionally, this technology can be widespread to use in the medical field to save more patients once this technology has been stabilized.